Hi, my name is Li-Hsuan Hsiao, and I'm a gynecologist in British Columbia, Canada. Second victim syndrome is described as when healthcare providers encounter significant moral distress following traumatic patient care events. Although broadly recognized in medicine, this remains under-recognized in surgery, and no systemic approaches exist to mitigate the potential harms of second victim syndromes among surgeons. When second victim syndrome is left unaddressed, surgeons not only suffer personal psychological harm, but their ability to care for future patients can also be compromised. Since surgical complications are inevitable when delivering care on a population level, and second victim syndrome is a high prevalence event after adverse medical events, we hypothesize that institutions may have a moral obligation to assist surgeons in navigating the repercussions of second victim syndrome. We employed a mixed methods approach to answer our research question with a 13-point Likert scale survey for quantitative data and a focus group and semi-structured interview for qualitative data. Our results showed that surgeons believe second victim syndrome is a universal experience among surgeons that healthcare institutions have a moral obligation to address. Surgeons further believe that any effective mitigation strategies must receive legal protection, similar to morbidity and mortality conferences. The culture, tenor, and tone of review processes after surgical complications can either reduce or exacerbate the burden of second victim syndrome. Successful interventions must be easily accessible, voluntary, and culturally acceptable. Furthermore, surgeons may suffer greater second victim syndrome compared to non-procedural physicians, as adverse events can be inevitable in surgery and may potentially be a high-frequency outcome depending on the patient population. To review the full scope of our study, I highly encourage you to read about it in the upcoming issue of the JACS.